In the modern world, treating a wound is a routine matter. Clean the area, apply antiseptic, bandage, and, if needed, consult a medical professional. But for most of human history, this was not an option. Tens of thousands of years ago, in the Paleolithic era, injuries carried significantly higher stakes. A single gash from a wild animal or a fall resulting in a broken bone could mean the difference between life and death. And yet, skeletal evidence indicates that many individuals survived such injuries. Some even recovered from major trauma. This raises a fundamental question. How did early humans, without access to formal medical knowledge or tools, manage to treat wounds? To answer this, it is necessary to examine archaeological records, comparative anthropology, and what has been preserved through oral tradition in existing hunter-gatherer communities. Human remains recovered from prehistoric burial sites show clear evidence of medical intervention. Neanderthal remains offer similar insights. One specimen, discovered in Shanidar Cave in Iraq, showed signs of multiple traumatic injuries, including the loss of an arm. Yet the individual lived for several years afterward. Such survival would not have been possible without ongoing support, suggesting that Paleolithic societies practiced some form of extended caregiving. What emerges is a picture not of isolated individuals, but of cooperative systems, where group members played a direct role in the recovery of the injured. In many cases, this may have been the first and most essential form of medicine, collective care. Treatment itself relied entirely on available natural resources. There is growing evidence that prehistoric humans understood and utilized plant-based remedies. One of the most well-documented examples is willow bark, which contains salicin, a precursor to aspirin. Chewing this bark would have had analgesic and anti-inflammatory effects, making it useful for pain relief. Another plant, yarrow, is known to slow bleeding and possesses mild antiseptic properties. Pollen from yarrow has been found in Neanderthal burial sites, suggesting it may have been used in medicinal contexts. Honey, which is naturally antibacterial and forms a protective barrier over wounds, was likely used as well. In fact, honey's medicinal properties remain relevant in modern clinical settings, especially in the treatment of burns. These discoveries point toward a basic but functionally effective medical toolkit, not based on theoretical knowledge, but developed through observation, experimentation, and oral transmission of information across generations. The process of treating a wound would have involved several steps. First, the bleeding would need to be controlled. Materials like moss, plant fibers, or animal hide may have been applied with pressure. In some regions, heated stones may have been used for cauterization. Next, the wound would be cleaned. Although bacteria were unknown, the consistent use of clean water or plant infusions could have served a rudimentary sterilizing function. Protection was the final step. Bark strips or flat bones could be used as splints. Sinew from animals might be used to tie or stitch wounds. Resins from trees, being both adhesive and antimicrobial, could seal wounds from external contaminants. It is important to note that these methods varied by region and group. Some treatments likely caused harm. Others, however, show surprising parallels to modern first aid. Perhaps the most remarkable example of prehistoric medical practice is the procedure known as trepanation, the act of cutting or scraping a hole into the skull. This practice has been documented in archaeological sites dating back over 10,000 years. Skulls from Europe, Africa, and South America show clean, deliberate openings, often accompanied by signs of bone regrowth, indicating that the patient survived. The purpose of trepanation remains debated. One theory is that it was used to relieve pressure following head trauma. Another suggests a spiritual motive, a belief that releasing certain forces from the skull could cure illness or mental disturbance. Regardless of motivation, the survival rate suggests a degree of skill. Trepanation appears to have been performed not as a last resort, but as a known procedure. Further evidence that even without formal medical systems, early societies had developed practical interventions. Medical care in early human societies also included elements beyond physical treatment. While modern clinical science focuses on physiological healing, recent studies highlight the role of psychological and social factors in recovery. Rituals, such as chanting, smoke purification, or symbolic body markings, were commonly associated with injury or illness. While these actions may not have had direct physical effects, they contributed to psychological reassurance and a sense of social cohesion. This cultural layer of healing is often overlooked, but may have significantly influenced recovery outcomes in small, high-trust communities. Some of the clearest analogs to prehistoric medical systems can be found in modern hunter-gatherer societies. The Hadza of Tanzania, for example, use crushed herbs to treat wounds and apply ash mixed with saliva to prevent infection. The San of Southern Africa use plant resins, insect-derived salves, and ritual dances focused on communal healing. These practices are not remnants of superstition, but reflect highly localized knowledge systems developed over thousands of years. In many cases, they have proven effective when evaluated through the lens of modern pharmacology. What this suggests is that functional medical systems can emerge and operate effectively without written knowledge, formal education, or institutional infrastructure. The stereotype of early humans as unsophisticated or indifferent to suffering is not supported by the archaeological or ethnographic record. Instead, what emerges is a portrait of adaptability, cooperation, and innovation under extreme constraints. Wound treatment in prehistoric societies was practical, observational, and social. It included the use of natural resources, shared knowledge, and coordinated care, all of which laid the foundations for what would later become organized medicine. The origins of healthcare did not begin in laboratories or universities. They began with basic human needs and the collective effort to meet them. The story of prehistoric medicine is not one of ignorance, but one of ingenuity. And it began, quite literally, with a wound in the wild.